what's going on with the eyelid? How do we rejuvenate it? How can we sort of address it non-surgically as well as surgically?
So I think CO2 laser is like a great in-between treatment, but certainly not as powerful as surgery itself.
If you're younger or don't have really that much going on with your eyes, then those non-surgical things that are easy to do in the office help. However,
Maybe it looked great in 35-year-olds, but as time progressed, it would make people look almost skeletal in appearance.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
hello, this is Dr. Roy Kim, one of the co-hosts of The Beauty Scientist, board-certified plastic surgeon with another board-certified plastic surgeon, Dr. Kristy Hamilton. Thanks so
Hi.
much for joining.
Happy to be here as always. Love chatting with you about all of our favorite topics. This one's exciting.
Yes, because we're going to be talking about eyelid rejuvenation. So we're calling this opening your eyes to beauty, the art of eyelid rejuvenation. So we can talk about, okay, what's going on with the eyelid? How do we rejuvenate it? How can we sort of address it non-surgically as well as surgically, and then go from there? So, Dr. Hamilton, in your opinion, what are some like the early to mid-level to even late-level signs of eyelid aging, and how do we rejuvenate it?
So this is some of the thinnest skin on the entire face, and it's usually one of the earliest places that we see signs of aging. So while patients may have things like rhinoplasty or chin surgery first, this is the first rejuvenating surgery that patients will consider. And what do we see? We see the skin starts to get looser. We see some drooping of the brow, some excess skin hanging here, fat pads kind of getting puffy in this area. Patients will say, I just feel like I look tired and I'm not tired. Why is everyone always asking that? And then we have loss of collagen in the skin itself, and it starts to look crinklier, and you get wrinkles in the corners of the eyes and also underneath the lower lashes themselves. And these are not favorable changes or welcome changes for most people. So those are what we first begin to see. And most commonly, patients start noticing this in their 30s, often mid 30s, because that's about 10 years of slow collagen breakdown or less collagen production relative to how much is broken down. It takes about 10 years to see that. So very common early
Yes.
area of
So
concern.
one of the things, of course, that we all know about is Botox or equivalent for crow's feet. One of the newer things that we know about as well is HA filler, some type of filler for the lower eyelid for mild bags, as well as occasionally PRP or PRF, which helps rejuvenate the skin. So we do know that if you're younger or don't have really that much going on with your eyes, then those non-surgical things that are easy to do in the office help. However, once you hit a certain point with loose eyelid skin, as well as significant under eye bags, then you probably need an operation. In terms of surgery, what do you look at for the surgical patient versus the non-surgical patient? Like, when do you make that distinction in your patients?
So when I'm starting to see significant skin excess and bigger bags, if you have a small bag, I agree with you. You can add a little bit of volume below it and it kind of hides it. Or certainly if people have a hollow, then it's easy to add something to actually address the underlying issue. But once we see truly big bags, adding volume is just going to make it look even worse, or the cheeks get too big and then it looks just odd. So that's patients really ought to consider lower eyelid surgery at that point. And then for the upper eyelids, Botox, if we get a little brow lift going on, that will help because the amount of eyelid skin is intrinsically connected to brow placement. So if we get the brow up a little bit, you can see how it makes my eyelid skin look like there's less there. And once that's not really cutting it, and we've tried laser treatments, which also cinches it up, that's a great time to consider upper eyelid surgery.
Yes, I totally agree with you. And non-surgical things that can tighten skin, including skin cream, lasers, I've used, and I use it with surgery as well. But I do think there's sort of a limit as to how much skin tightness you can really achieve without actually cutting out the skin and removing it and then closing it up. What is your opinion on serums, creams, lasers, chemical peel, everything really that can tighten skin?
Yeah, I think creams and serums, that's going to be part of your ongoing maintenance. I think it helps slow progression and plump fine lines and wrinkles, maybe help with the crepiness, but it's not going to be transformative. I think a powerful CO2 laser treatment or ablative laser treatment, if you have a little bit of extra skin, can be really powerful. And I'll even offer it after eyelid surgery as well, because we may have removed the extra eyelid skin, but the crepiness is still there. So we can still use that to stimulate collagen. So I really like it, especially for lower eyelids, for patients who maybe they're not ready to have a full lower blepharoplasty or lower eyelid surgery, but they still want to do something. So I think a CO2 laser is like a great in-between treatment, but certainly not as powerful as surgery itself.
Yes. So for the viewers out there, we all know we're talking about upper eyelid, lower eyelid surgery, what we call blepharoplasty. So Dr. Hamilton, one of the things is, of course, as plastic surgeons, we differentiate the two. For the upper eyelid blepharoplasty, upper eyelid lift, what things do you like to do as a plastic surgeon to really rejuvenate that area?
That's a great question. So I think the modern upper eyelid surgery is about preservation as much as it is removal. So we are looking at the layers of the skin, followed by some of the muscle that allows us to squeeze our eyes shut, and followed by some fat pads. And those are the main considerations for the upper eyelid. Old school upper blepharoplasty, they used to take out all the fat that was here, and that maybe looked great in 35-year-olds, but as time progressed, it would make people look almost skeletal in appearance, because we actually we realize now we love fat in the face. Dr. Kim and I are always, we're adding it back in. We're injecting it all over the face and adding volume. So now I remove the extra skin, whatever can be pinched, so that I keep that incision exactly in the eyelid crease. I like to remove a little volume from the inner fat pads, or the ones close to the nose, to open up the inner eye area, but I just reduce it. I tighten up the muscle and then do a meticulous skin closure so that that incision heals really, really beautifully. And that's my favorite way to do upper eyelids. What about you?
Very similar to you. And of course, we know that the upper eyelid has sort of like fat pockets, fat pooching, fat sort of laxity that causes a slight bag in the upper eyelid. But really the big thing in the upper eyelid is not having too much hollowing of the upper eyelid. And that's important to realize when we're doing surgery there. With the lower eyelid, of course, we're worried about much more about the under eye bag. We're worried about this line here caused by a ligament. And finally, I do think that we know this, but patients don't know this. There's actually usually not that much loose skin of the lower eyelid. There's a little less. And finally, we need to support the canthus, this structure where it gets a little loose here, the portion of your body where eyelashes grow out of. And I was just wondering how you address all of those concerns in your lower eyelid patients.
Yeah, so lower eyelid, I think definitely a much more complex operation than the upper eyelid. And a little bit of excess tightness in the upper eyelid, that's going to stretch out with time. With the lower eyelid, you really have to be careful to still be conservative, because you do not want the weight of the face pulling down on your lower eyelid. No one signed up for lower eyelid rejuvenation wanting to look like this afterwards. So the key is making sure that the lower lid is well supported. In older patients with more looseness, that may involve tightening up the lower lid or providing additional support there. And then it involves a very systematic analysis of what the underlying issue is. For some patients, their fat pads may not be protruding at all. They may not have any bags. So why remove additional fat from them? That's actually rejuvenating and makes them look youthful. Versus if someone's got a really deep ligament, a very tight ligament, big bags, then we know we're going to have to release that ligament. We're going to have to reduce that fat, tighten up the tissue covering it to make it nice and smooth, maybe even adding a little bit of fat in that groove where the ligament used to be. So everything's very customized and very tailored to the patient. And we can make that a more like a maximally invasive versus a smaller procedure with just little pinches of skin removal, depending on what's needed. For younger patients that have no extra skin and it's really just bags, I'll approach it through the inside of the eyelid and just reduce the fat pad and not take out any skin at all. Maybe just do a little laser resurfacing on top for tightening and collagen induction. So I think that's the key, just knowing that there is no one operation that suits everyone, and your surgeon that you choose should have a number of different options available, different techniques available to them so that they can choose the one that's ideal for you.
I totally agree. And I think the other important thing that patients need to realize with the eyelid, the lower eyelid, is the lid cheek junction. You want to blend it so that the lower eyelid is smooth in conjunction with your cheek. Younger patients, I think it's a little easier. Older patients, we may have to tell them that you need a facelift or fat grafting to the cheek as well as fat grafting to the lower eyelid to really get the smoothest and best rejuvenating result.
I agree. And again, that's why you're seeing a board certified plastic surgeon. You need someone that's going to do a complete holistic assessment of your face and analysis of your face, because, you know, we don't exist with body parts in isolation. We're not just looking at eyes and cheeks and jawline. It's about how all of this comes together. And that's what's going to yield the most beautiful, most natural results.
I agree. And then when you're talking to your patients about upper eyelid, lower eyelid, or both, what types of things are you discussing with them before surgery about the recovery process, about time off from work and life and all those things?
That's a big consideration, because these are not super painful operations. I think they're fairly easy to recover from, but when those early days of swelling, especially if you're doing uppers and lowers, it can be very tight and difficult to even close your eyes at first because of the swelling. So I tell my patients, you're gonna be living your life like a rock star for the first week. Sunglasses are gonna be your best friend, because you put those on, honestly, the rest of you looks pretty normal. Dry eye symptoms are really common, and so I have them use some lubricating eye drops and some steroids to help get the swelling, inflammation, and bruising down. And I tell patients, I think it's 2 weeks before you're looking kind of socially appropriate, not a super high stake setting. Like, I think if a little concealer covering residual bruising, your sutures are out at a week, you can kind of go out into the world and not be turning heads. But if you're really trying to look good, you're going to need at least a month after upper or lower eyelid surgery for the most part.
And I think you hit the nail on the head. One of the things is that this operation actually is truly not that painful. So I tell my patients, because I'm up here in Techville in Silicon Valley, if you don't have any meetings and you don't have to show up on video and you want to get back to work, you could actually get back to work on your computer or talking on the phone pretty quickly. However, being seen in public, being on a video conference call, that's a little different. You may want to take 10, 14 days, a little longer before you're out there seeing people.
I completely agree. So it's like you're functional, your brain's working, you're not on a bunch of drugs, you're doing well. It's just a question of like, what is your comfort level? What's your job position? Can you work from home for a little bit? Or are you the face of a company or working on on TV? You might need a little bit more time, just depending on what you do. What about risks of surgery or complications? How do you counsel your patients about that? And what can we do to minimize complications in eyelid surgery?
Yeah, as you know, I think the biggest risk is bleeding. So I think what we worry about is the overall aesthetics and bleeding and infection. The face has really good blood flow, so I guess infection can occur. It just isn't as common compared to other types of plastic surgery we do. Bleeding is a much bigger concern, because we do not want any excessive bleeding around the eye, around the optic nerve, or even just in the cheek or eyebrow area. So it's critical for patients not to be on any blood thinning medication beforehand. As surgeons, we're really, really, really OCD about making sure that there's no bleeding before we close up the incision. And even afterwards, patients, we tell them all the time, hey, don't do any, CrossFit activities the next day after surgery. Don't take any blood thinning medications after surgery and so on, because we want you to heal up as well as possible. I also think in terms of complications, the appearance of your eye, how much skin laxity or skin tightness you have before surgery sort of determines how you feel after surgery. You mentioned that dry eye is a complication. That's because, especially with upper eyelid lift, we have a lot of loose skin and it's been able to cover the cornea, the actual eyeball, very well over many years. Well, you may look better right after surgery, but the ability to blink as hard, to create tears, all that swelling slows that down, along with coverage of your cornea, is very common for patients that have dry eye afterwards, and we need to make sure that doesn't last longer after surgery. Anything else you want to throw in there in terms of potential complications?
I think the main thing is that we really take the time to measure really precise placement of scars, things like that. So these are all essential components of the surgery to make sure that at the end, like, you want that scar right in the fold, not too high, not too low. So these are some of the things that we'll address in revisional surgery sometimes when patients come in. But truly, eyelids, the skin is so thin, it heals really well in essentially everybody. And it's also important to, be conservative. You're still going for a beautiful result, but just don't take out too much. Don't take out so much that we're pulling on the lower eyelid. That's considered a complication too. You can always take out more. So I think a natural result with a significant improvement is where you want to be with any plastic surgery.
Yeah, that's the amazing thing with upper and lower eyelid lift. Proper placement of the incision, it's very difficult to see, even with no makeup on, once it's healed up. And so for patients out there, it is a very good, aesthetically looking overall procedure in terms of that.
Yes, which is important because it's right in the center of your face.
Yeah. Well, anything else that you wanted to add to our discussion, Dr. Hamilton?
No, I think it's a beautiful operation. I think it's, like we discussed, fairly easy, pretty simple recovery afterwards. And it's an extremely popular operation because everyone likes having that bright look around their eyes, looking refreshed. And I would add that it's popular for both men and women because men similarly don't want to be asked in the workplace like why they're so tired all the time. So I would encourage the viewers, if you have any questions about it, ask us in the comments. If there's other directions you want to take, we're always looking and we will create more content based on that. And answer your questions. Thank you so much for listening.
Well, thanks so much for joining me as always, Dr. Hamilton. And to all the viewers and listeners of The Beauty Scientist, as Dr. Hamilton says, we want you to stay beautiful. So thanks so much for joining us.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.